Hello, everyone. My name is Arina Nurifanti. I'm a first year PhD student at School of Medicine, Dentistry, and Nursing, colleague of MVLS. Today, I would like to share my topic, my research works about thinking and memory problem after stroke. So, first of all, maybe all of you here ever hear about stroke. So I want to know from you, do you know about stroke disease? Are you familiar with this? Okay, we will see. The answers are rising. We have 35 participants here. We collect 32. Yeah, maybe I think it's enough, 33 out of 35. Yeah, thanks, Dr. Maxine. So we have 19%, 58% who say yes, knowing about stroke, and 42% do not know about stroke. Okay. Yeah. I'm sorry, I think, okay. So when you think about stroke disease, maybe, probably everyone will think about the physical impairment, the physical disability that appear from the stroke patients. For example, the abnormal faces, the abnormal expressions, the unlinear, the partial paralysis, uh, like this, like the arm and leg weakness or paralysis. So maybe mostly everyone think about the physical disturbance, physical appearance from stroke disease. But is it true that stroke only affect our physical appearance? So let's talk about a little definition about stroke. So stroke occurs when the brain suffers blood flow interruption caused by either the broken of the vessels in the brain, or blockage in the brain vessel. The broken affected generally by hypertension, and the blockage generally affected by lipid, hypercholesterol, and then obese. So the vital effects of these conditions, the brain is lacking of oxygen and nutrition. While every time, every second, every day, our brain fundamentally, vitally needs oxygen and sugar to enhance and to boost its life. So from the stroke disease, we have three most group of complaints affected by this disease. The first is physical symptoms, and the second cognitive symptoms, and the rest is emotional symptoms. We talk about physical symptoms. Physical symptoms are ranged from the motoric impairment like muscle weakness, stiffness, imbalanced gait, that when such stroke patient walking, they look like lose their balance to maintain their strength, and then swallowing disability, speech disability, language disability. The physical symptoms are the most characteristic of disabilities that get studied, researched, and that get more attention from healthcare providers. And the second, cognitive symptoms. Meanwhile, the definition of cognition, the cognition itself is the state of function in our brain that executively regulates many of amazing function. For example, our memory, our thinking process, learning process, attention, analysis, judging, calculating, until solving any of problems. So this is the cognition. So the cognitive symptoms range from the impairment from attention, problem solving, until the memory. And the third one is emotional symptoms. The emotional symptoms range from distress and depression. So most signs and symptoms of stroke are muscular weakness and partial paralysis. Okay, so let's think about it. Everyone, do you believe that you could possibly be unrecognized by your beloved one? Imagine your beloved one, your spouse, your parents, your best friends unrecognize you. Can you imagine if your beloved one becoming totally different persons with different personality that you know during this time and suddenly lost their independence ability? You have no idea what's going on and you lead to be depressed, stressed, so is your beloved one. However, from physical symptoms, cognitive symptoms, until emotional symptoms, the significant attention covers only for severe physical disability, while the post-stroke thinking and memory problems have been relatively ignored. Okay, this is the globe and part of Indonesia, my home countries, the archipelago nation. In Indonesia, the prevalence of stroke is rising each year, with also the death tolls rising each year. But the prevalence for stroke control rate is only below 50%, exactly 39.4% in 2018. It means that the capability of this country to control rate of stroke is still low. We have evidence to quality of care dependencies from hospital admission to outpatient and community. Stroke patients follow a care plan that starts at the hospital and which focus only on acute care when the stroke event happens. The nurses, the largest amount of healthcare workers, particularly in Indonesia, get used to apply nursing assessment focused on physical symptoms only, while the cognition, for example, for thinking process, for memory, and emotion aspects are ideally supposed to be in same level of importance. Research study is essential to discover why most Indonesian healthcare workers are less attention and less skilled in this issue area. I mean, this issue area is thinking and memory problem. So we have the vital issues here. The vital issues here in Indonesia particularly are cognition. The cognition, previously I stated that cognition is the function, the state that our brain regulates executive and amazing function like memory, thinking, learning, process, attention, and etc. And then the nurses, and then assessment and management. So why these issues are vital? Because every stroke patient will deal with the afterlife stroke. They will deal with life after stroke with families, with community. So the morbidity, the disability that embedded after stroke event will remain until the end of their life. So this is my research works. My research work range into 3 steps. The first is clinical practice guidelines review. I collect and I review and I analyze many international guidelines that the topic talk about stroke management, particularly for memory and thinking problem. And then I apprise the quality assessment of the recommendation that produced by these practical guidelines. And then I jump into the quantitative study. The quantitative study will collect the data by observational study by nurses by Indonesian nurses in any hospital in Indonesia. We collect the data about knowledge and skill from nurses about this assessment, this screening of stroke patients. And then I jump into qualitative study. The qualitative study will explore the nurse perspective and the nurse needs about why the memory and the thinking process is very essential. The cognitive assessment is very essential for stroke patients. From hospital setting to community setting, from the patient admit into the hospital until discharge into their home. So, from the clinical practice guidelines review, the general key recommendations by the guidelines I encompass into three key recommendations. The three recommendations are: the first, screening. Screening, it means assessment, finding the risk and finding the case of cognitive problem, the memory loss, the thinking problem. So why is important? Because the first that you have to know that the memory loss cannot be cured. It only can be prevented other than cured. So it is very essential for us, for healthcare workers, to find the risk of cognitive impairment on the stroke patients right after the stroke events. The assessment and the screening can be done by trained doctors, nurses, or psychoneurologists. The second recommendation is the prevention, some drugs adherence, and on drugs interventions. Drugs adherence related to prevent stroke and prevent complication. So it is essential to stroke patient to obey with medical order to lower and to prevent the complication risk. For non-drugs therapies, we have cognitive behavior therapy and occupational therapy. The occupational therapy, for example, like the daily activities, for example, writing, speaking, like peer groups, talking, like that. And the third recommendation is lifestyle management. The lifestyle management is pivotal things to prevent stroke, either to prevent the stroke recurrence. The lifestyle management range from the management of hypertension. The hypertension is like blood pressure control, because the hypertension or the rise of blood pressure can lead to broken of our blood vessel in the brain. And then the cholesterol control, for example, someone with obese or someone not obese but with hypercholesterol. And then body weight control, smoking control, tobacco control, because these factors are leading to stroke event. So after all of my slides, why this importance? The important things from this research are: first, it is essential to nurse finding risk and incidence of thinking and memory problems on stroke patients. Second, finding the thinking and memory disruption will lead to action of management. The intervention, the good management, will address the disease appropriately. And the third, thinking and memory problems after stroke will lead to mental health problem and worsening quality of life, both among patients and their families' caregivers. I think that's all for my presentation today. Thank you very much for your attention. If there are any questions, you can put on the chat below. Thank you very much.